Hello everyone, today we'll be learning Roga Nidana, the first chapter of Roga Nidana, disease of the Pranavaha Srothas, and the topic we are dealing with today is cough. So Kasa. Kasa is nothing but aggravated vayu which is expelling through the mouth. Via the throat region is called as Kasa. That is vayu expelled out through the Srothas of the Shiras via Kantha or Swarendra. Kasa is a reflex. So Kasa might be a similar reflex like sneezing or a symptom of any disease or complication or an independent disease itself like Vadaja Kasa or Pittaja Kasa or Kasa could be Kasa itself. So Kasa is seen as a Lakshana of 23 Rogas. So next is Nidana of Kasa, which is pathology or what exactly causes Kasa or cough. First one is exposure to dust or fumes. Imagine as if you are traveling by a bike to somewhere and suddenly you get exposed to fumes and dust or smoke and you get coughing. So it could be remembered in such a way. So exposure to fumes or dust and excessive physical activities or consumption of dry food. If you're consuming extremely dry powdery substances like could say some health drinks or something and then it literally sticks on the walls of your throat and you get coughing. And then entry of food through the respiratory pipe instead of the food pipe could get you coughing, and suppressing of sneezing could get you coughing. Before getting into the Samprapti, we will learn what Udana Vayu is. So Vayu is basically, Vata is basically of 5 types, which is Prana, Vyana, Apana, Samana and Udana. From that, what causes cough is Udana Vayu, the disturbance in Udana Vayu. Let's know what Udana Vayu is. Udana Vayu is located in the chest region. It helps in the functioning of heart, lungs and helps in communication and activity. So it is chiefly located in the chest region. All you have to remember is that. Now Samprapti. So I've already mentioned some Nidana before, and all of these Nidanas leads to the increase of Vada dosha. I've told you that if exposure to dust or fumes, suppressing of sneeze, and then entry of the food into the respiratory tract instead of the food pipe, etc., could get you cough. So because of all of that Nidana Sevana, the Vada in your body gets increased. The Vada that is getting increased is Udana Vayu. Udana Vayu, I told you already that it's located in the chest region. So this Udana Vayu, which is in the chest region, associated with other doshas, that is Pitta and Kapha dosha, moves upwards from the Uras, from the throat, from the chest and throat to the Shiras. Okay, and all of these Vada which has travelled and reached the Shiras is expelled out through a bout-like sound called cough through the mouth. So why do people bend while coughing? So it's due to the contraction of muscles. So when we are coughing, the muscles of our body, certain region of like the chest, the back side, the planks of the back and the mouth, throat, everything is involved. So while you're coughing, automatically the muscles of all these regions gets contracted, and because of the contracting of the muscles, we bend while coughing. And next one is Samprapti Khadaga. So the dosha which is involved in Kasa is Vada, which is Vada gets predominant along with the other 2 doshas, which is Pitta and Kapha. The Vada is predominant here, and the dusha happens to Rasa. Strodhodushti is Vimarga Gamana. Srothas involved here is Pranavaha Srothas, Udbhava Srothas. It is Udbhava is like Amashaya, and Sanjara. Sanjara Sthana is Uras, chest and throat, and Vyakta Sthana is Kantha and Mukha. Like an Ama is Jadarakni Janya Ama, the Roga Marga is Abhyandara. And now it's Purva Ruba, which is the symptoms, premonitory symptoms of coughing. So when you cough a lot, you get your throat very dry and there would be a sense of irritation in your throat, dryness in the oral cavity and sense of itching in the throat, sense of difficulty in, since the throat is getting, you cough a lot and the throat is a lot involved in the process, so there is a difficulty in swallowing. So these are the premonitory symptoms of Kasa. Now types of Kasa. There are 5 types of Kasa, which is Vadaja, Pittaja, Kabhaja, Kshayaja and Kshadaja. The first one is Vadaja Kasa. So Vada is basically, in terms of Vada, anything related to Vada is very dry, cold, everything. So similarly, what causes it is that if you're taking dry and cold food and nutrient deficient food. Adivyayava, excess traveling. I told you already in the symptoms that if you are traveling by a bike, you get to exposed to a lot of dust and fumes. Yes. Similar to that, if you're traveling a lot, you are likely to get cough, and suppressing of natural urges. And then lakshanas of Vadaja Kasa. So what are the symptoms? Cough is Vada, I told you. Vada means dry, so the throat will be dry, and obviously there would be dry cough. So Vadaja Kasa could be related to dry cough. So there will be dry cough and the throat will be dry, and there is a pain and dryness in the chest and throat region. There will be horripilation. So I've told you already that Vadaja Kasa could be correlated to dry cough. So in case of dry cough, we cough a lot, and it's pretty difficult to handle the cough since we cough a lot and we'll get tired. So similarly, loud and continuous coughing would lead to blackouts, hoarseness in voice, and loss of strength, and no mucus is seen, or a little bit of mucus is seen after long coughing. So it could be remembered as if loud and continuous coughing would be there, and automatically when you are coughing a lot, you lost your strength and there would be blackouts, and then you keep on coughing, which is a stress to the throat, and you get hoarseness in the voice. Okay. Then it's Ubashaya. Ubashaya is oily, salty, warm food and drinks will be given for the reduction of the cough. Similar to what we do on a daily basis. If you are getting a cough, like continuously we are coughing, in order to just dim that down, we drink some lukewarm water or warm food, which would relax the throat. Okay, so Pittaja Kasa. Pittaja Kasa, Pitta could be related to hotness, like burning sensation, etc. So similarly, excessive hot and spicy food intake, excess sour intake, alkalis, mentally afflicted to anger, and exposure to high temperature, like staying close to high temperature, or if you are out to the sun, then like it'll lead you to Pittaja Kasa. So similar, you can correlate with day-to-day activities. If you're like taking a shower and then you're like exposed to a high temperature or outside the sun, then it could lead you to Pittaja Kasas, like Pittaja Kasa, yes. And now again it's Lakshanas of Pittaja Dosha. So Pitta, productive cough with medium bouts. So I told you already in Vadaja, they're like the cough is uncontrollable, where in case of Pitta, the bouts will be medium. There will be medium level of coughing. There would be sputum with yellow discoloration. In case of Vada, I told you that there would be long coughing and there would be no mucus or a tad bit of mucus. Bitter taste in the mouth, altered voice, which is a common symptom of all the kasas, all the types of kasas. Experiencing hot fumes from chest, since it's Pitta Kasa, Pittaja Kasa. Thirst, burning sensation, loss of taste, giddiness, and sputum with mucoid associated with Dushta Pitta, which is sputum, which is yellowish in color. So Kafacha Kasa. Kafacha Kasa means Kapha is related to Gurutva. So if you are taking intake of heavy, oily, greasy, sweet food that is sticky, and along with this heavy food you are having a sedentary, lazy lifestyle with less physical activities and excessive sleep, then there would be an increase in Kabha and obstructs Vada in the Pranavaha Srothas. So what is Pranavaha Srothas? So Pranavaha Srothas is our small channels of the body. So Pranavaha Srothas is a key in distribution of nutrients to the whole body. So channels through which the nutrients are distributed. So there is an increase in Kabha dosha, and this Kabha, imagine as if the Kabha dosha is clogged in the channels and Vada is moving through that way, and this Kabha already clogged in obstructs the Vada to move, and the Vada is trying its best to move out and expel out through the mouth as cough, but the Kapha dosha is not letting it move. So the Vada keeps on pushing, and like it attempts to pass, and it pushes out the channel along with the Kapha dosha, which is which was clogged there, and the Vada comes out as a cough, and the sputum is Kabhaja dosha. Okay, you can imagine in such a way. Now the Lakshanas of Kabhaja Kasa, less bouts of cough compared to Vada and Pitta. I told you already, in Vadaja we cough a lot. There is a lot of coughing happening there, and in Pittaja there is medium level of coughing, and in Kabhaja there is only less cough compared to the rest. But there would be less cough or less bouts, but there would be a large amount of sputum. And then there is the third point, little effort of cough, large quantity of sputum. So since I told you the body is already heavy because of the Kabha, there would be less digestive capacity, and then there is a loss of taste and interest in food since it's already heavy there. And then since its Kabha is in, like, you can correlated to wet cough. Okay, if there is a dense, like if there is a huge amount of kapha inside the body and there is a dense mucus, I already told that there is a large amount of mucus getting out. If you like coughing a lot, sometimes you might vomit and there would be dense amount of mucus coming out. Okay, due to excess of kapha in Srothas, patient feels to vomit. Okay, sweet taste in the mouth. Since it's kapha, there will be sweet taste in the mouth and mouth will be smeared with thick saliva or mucus. Again, so next one is Shadaja Kasa. So Shadaja Kasa, Shada means injury. So any sort of injury to the chest region could lead to Shadaja Kasa. So the injury may be vigorous exercise, lifting heavy weights, any sort of injury to the chest could lead to Shadaja Kasa. So basically there is a shada over the chest and the vayu gets filled in the injured area and causes pain. Initially there would be dry cough and later there would be spitting of blood. Okay, and then there would be severe pain in the thorax region, pricking needle sensation and excruciating pain. I told you the muscles get involved. There would be contraction of muscles while coughing and there would be pain in the area already affected and also to the smaller joint associated as well. Then change in voice. Another key way to differentiate Shadaja cough from other coughs is that first of all there would be pain in the chest region and secondly the breath. The breath resembles a cry of a pigeon. Okay. Shayaja Kasa. Shaya means depletion. So if a person is not taking sufficient amount of food which is of low quality and quantity, then and involving in excess sexual activities and suppressing natural urges, automatically there will be Agni Vaishamya and increase in Tridoshas, which causes Shaya or the depletion of the body. Already it is Shaya involved here, so there would be body weight loss, decreased health, and there would be cough where the sputum is greenish blood stained, foul smelled with pus. Bouts get triggered by consuming hot or cold elements. There would be roughness in the palm associated with fever and pain in the plank region, that is the back region. So there will be recurrent onsets of running nose, loss of appetite, loose stools and cracked voice due to chronic coughing. Since there is a diminished health and there won't be any immunity there will be a less immunity, the person is likely to get all these causes. And Sadhya Asadhya. So Sadhya, Vada, Pitta and Kabha are Sadhya and Asadhya is Kshayaja. So Shayaja is Asadhya, but if Shayaja is of a recent onset and the person can undergo Bala treatments or could retain back his health, then it's Sadhya. But otherwise, if it crosses a level after that, then it is Asadhya. Then Yapya Sadhya. So if Kasa is started in an old age, which is Jaraja Kasa, it is Yapya to cure. It is a tad bit difficult to cure it.